morning, everyone. Welcome to the Friday Forum. We have Brant, we have all the directors here. We're going to give you some great information today. I'd like to start off by first of all thanking Brant and thanking all the directors and this great surge of COVID-19 cases that we've had throughout the state of Florida in keeping us safe. Now, keeping us safe requires them doing their job, and it requires you doing yours. So you have to be a part of the team, and 98% of you are, and I thank you for it. So it's going to be some more tough times. It's not going away, but as I told you before, when the going gets tough, the tough get going. And so it's time for us to keep on going, and I thank you all for it. And with that, I'm going to turn it over to Brent.
Good morning, everybody, and welcome to the Friday Forum. Today is July 17th, and we are in day 42 of phase 2, which is the governor's plan for reopening America. Let's dig into the numbers and take a look at what's happening. Here in the state, we're at 315,000. It went up over 13,000 cases, new cases overnight. In Pinellas County, we are at 12,000 with about 300 fatalities. And in Pasco County, we are stable. Pasco County continues to have really outstanding numbers with only 40 fatalities since the beginning of the pandemic. Here in the United States, the numbers are 3,570,000, and yesterday represented the single largest one-day increase in new cases ever recorded, with 139,000 new cases being reported yesterday. Testing continues to be very, very slow. We're at 131,000 people tested now in Pinellas County, and the infection rate is running at about 9.4%. We continue to see a gradual increase in those numbers day over day. The hospitalization rate has jumped up here in Pinellas County as well. We're now at 1,091 and 228 in our specific zip code 33759. I'm going to turn this over to Leslie now and ask her to run through the numbers for Regency Oaks.
Good morning and happy Friday. So here at Regency Oaks, we have currently 14 residents that are under quarantine, and they are non-COVID related hospital stays and overnight stays away from Regency Oaks. We have 9 residents in our skilled nursing on quarantine and no one in our assisted living under quarantine. For staff members, we have 10 independent living staff, 1 assisted living, and 8 skilled nursing staff that are under quarantine at this time. For residents who are experiencing COVID-like symptoms or are testing in progress, we have 1 resident in independent living being tested, 0 in assisted living, and we have started our retesting in the licensed building. So we have 37 skilled nursing residents being tested at this time. For employees going under flu-like symptoms or COVID symptoms and testing in progress, we have 8 independent living staff being tested, 15 in assisted living, and 125 in skilled nursing being tested. Again, that is our bi-weekly testing for our licensed buildings. Confirmed cases with COVID-19, we've had our 2 residents in the past, no new ones have been confirmed, and employees, we have 13 confirmed COVID cases. So overall, for residents is 2 positives, but negatives is 130, and for associates, we've had our 13 positives, but 255 negatives. Again, we want to see the negatives number continue to grow and not the positive. Thank you,
Leslie. As Don was mentioning earlier, the reality is that COVID does not appear to be going anywhere. it looks like it's one of those things that we're going to have to learn to deal with. And one of the things that we are doing this afternoon that I wanted to share with you is all of the managers are getting together and trying to do some brainstorming on what we can do within the guidelines, not in terms of lifting additional restrictions. We're going to continue to have these restrictions in order to keep you safe and prevent the spread of the virus. But can we find ways to deliver service in a way that is a higher quality of service and more engagement? One of the things that we are absolutely aware of is a sense of isolation that many of you are feeling. You're isolated to your apartment, you're not able to see your friends and your family, you're restricted in your movement, in your meals, and what you can participate in and can't participate in. And so we wanted to go back and do a really deep dive evaluation of, are there things that we're doing that we can enhance? Are there unnecessary restrictions that we can lift? And try to create a better quality of life and higher level of engagement for all of our residents. So we're looking forward to reporting back to you on Monday the results of this exercise, and hopefully we'll come up with some great ideas to make your quality of life a little bit better. So let's go to the department reports, and first up is Christine with Innovative Home Services.
Friday. I would like to start off by saying thank you to everyone who attended our estate sales, and thank you so much for wearing your masks and being 6 foot apart. I really appreciated that. If you need any type of services from us, please contact me at extension 502 or 503. We are here to help you. Thank you and have a great weekend.
Hi, I'm Ransom Macy. I'm the healthcare administrator at the health center next door. I'm next up. This week at the health center, unfortunately, we had another associate test positive for COVID-19. This associate worked exclusively in the nursing home portion of the building. So as a result of that, we are testing all the residents that reside in the nursing home part of the building over there. The associate was completely asymptomatic and is exhibiting no symptoms at this moment. We also are on our deadline for our 2-week testing from the Agency of Healthcare Administration. So this week we began testing all the staff again that work exclusively in the health center and all the vendors, and we hope to get those test results back for residents and staff Monday morning. Thank you.
My name is Ricky Bacher, food service, and I am next up. Again, one thing that I would ask of the residents, if you're going to go to the tavern for lunch, when you fill out your menu, please circle that you will be attending the tavern lunch so that we have enough food for everybody. Thank you and have a great day. Sherry is next up.
Good afternoon, everyone. Happy Friday. As you may already know, Bethany is no longer with us. We do wish her the best of success as she relocates to Arizona. I do believe most of you have had the pleasure to meet Sandra Andrade. She is at extension 506. She's an excellent addition to our staff. We're all very excited to have her here. Please be patient with her as she will have questions to come to me, but I know you'll be very, very happy with her. So don't hesitate to contact me as well as her, and we'll assist you with everything that you need. Thank you, and I'm going to turn it over to Amy Waugh, our Director of Sales and Marketing. Have a great weekend.
Good morning, Amy Waugh, Director of Sales and Marketing. Recently, you received a letter in your mailboxes from us promoting the resident referral credit that we are paying out to any residents who refer a friend or a neighbor or someone that you know from church or anyone that you think might be a great candidate to live at Regency Oaks. Resident referrals are the best sources of referrals from us because they're essentially your neighbors and people that you know. So if you know anyone, please contact the sales and marketing office and give us their name and contact information so that we can follow up with them. And once they decide to move in and join us, you will receive a $3,000 credit to your monthly fee. Now I'd like to turn it over to Darwin Perez.
Good morning, everyone. My name is Darwin Perez, Plants Operations. I just want to give you a quick update. We just got the approval on the exterior painting. We should be scheduling to begin next month. Thank you. I'll turn it over to Jesse.
Hey everyone, Jesse Rosalie, your EVS Director. Just wanted to give you all an update. We will be working on work orders within the next few weeks. We're going to start coordinating those. As long as those work orders does not require for us to be in your apartment for more than 20 minutes. So things such as turning mattresses and such, we're gonna start working on and coordinating. So expect a call from us to coordinate those. And I'm gonna turn it over to Tiffany.
Good morning, Regency Oaks, and happy Friday. I just wanted to make everyone aware, because I've gotten a few questions regarding it. When we upload our video onto channel 732, when it's Brent's COVID update, unfortunately, sometimes we're not given the option for the closed captioning. I do apologize for that. We do try to keep close tabs on that so that if the closed captioning is available, especially for our residents who are hard of hearing, we try to make sure to add that when we can, but we do ask for your patience, and I do apologize for that technical difficulty. Thank you and happy Friday. And now I'll turn it over to Lauren in Administrative Services.
Hello, everybody. I'm Lauren Rose, Director of Administrative Services. You may have noticed some changes that we have made in the entrances to the north and south building. This is to help us capture everyone coming into the building to be sure that they are being properly screened, having their temperature taken, and being asked the questions so they can answer each one individually and make sure that we have gotten every single person entering the building to be verified that they are allowed to be in the building, as well as safe to have them in the building. Hopefully you will find this helpful, and your cooperation is very much appreciated. Thank you. Turn it over to Sandra.
Hello, I'm Sandra Novotko, Human Resources Director, and I just want to give a shout out to all of our staff. We're continuing to work extremely hard for our residents during this time.
That was a very, very interesting session. I have some questions from the residents I'd like to ask. This deals with the ROVA meeting that was televised on Tuesday. I've had numerous people tell me that they really enjoyed it. I've had several tell me that they missed it because they were at the doctor's, for example. So the question is, Tiffany, can we televise the ROVA meeting again?
Thank you, Don. We can most definitely televise it again. We will give enough notice in advance for our residents so that they can schedule out in their agenda so that they can see it again. So we'll make sure to advertise that sometime next week.
The next question goes to Brant. Brant, I've had numerous residents asking me, how much longer is this going to go on? And of course, we know with all that Florida was actually ranked 3rd in the world recently. And so we know it's going to go on for at least a couple months more. But people respect your opinion, Brant. And I was going to ask you how much longer you saw this going on.
Thank you, Don. I'm anxious. You look at the numbers and they just keep going up and up and up. And so the trend is suggesting that the end of COVID is not anywhere close. And I think it's fair to say that this is probably going to extend for at least another 90 days. I think we can have the biggest effect by changing our approach on how we deal with COVID. And that's why I want to go back and talk about the meeting that we are scheduling today. Because COVID does not seem to be going away and the numbers are not improving, we know two things. Although the number of new cases is increasing rapidly, the number of fatalities is not. The number of fatalities is actually dropping every single day. It's going in the exact opposite direction, which is a good thing. That's why that is happening is twofold. One, we're beginning to learn how to deal with COVID. We know that early detection is critical. We know that getting under the care of a physician early makes a difference in your survival rate. We know that we now have the resources and the tools to help you defeat COVID if you are infected. And so we're beginning to see improvement in the numbers. The second thing that contributes to that improvement is the herd inoculation that is going on in the country. One of the positive effects of these large exposure numbers is we're also getting 140,000 people a day exposed to the virus. And the reality is that the vast majority of those numbers, so what that really means is that 91.6% of the people who come down with the virus are actually going to improve and get better. And so there are some trend lines out there that are encouraging. Here's where I think our focus needs to be. Our approach and mentality has to be keep residents safe, put in precautions to restrict movement, stop mobility, limit the exposure. We almost have a hunker down mentality, so we've locked ourselves in the bunker and we're keeping ourselves safe. That's been a very effective means of fighting this virus, and as Don pointed out, it has resulted in really low numbers. So while other communities across the state and the nation have struggled, Regency Oaks has fared very well. Our challenge going forward is if we accept the premise that COVID is not going away, is there a better way to live? And do we want to lead the rest of our lives hunkered down? And I think that that is where we need to focus our energies, is finding ways to live our lives better over the remainder of this COVID infection.
For tuning in. I know you still have some questions, and I would ask you to please, if you have questions for next week, pass them on to your board members, pass them on to me. We have a great staff. They're working extremely hard to keep us safe, and you're doing your part. So I thank you all for it.